One of the most joyful and sometimes challenging aspects of welcoming a newborn is feeding, and it is completely normal to have questions about whether your little one is getting enough nourishment. Are you sometimes left wondering if your baby is truly thriving during these precious early weeks? Is your baby communicating a need for support around feeding? You can identify feeding difficulties in newborns by carefully observing specific signs during and after feeds, as well as by monitoring their overall well-being. Key indicators include prolonged feeding times, often lasting more than 30 minutes, or very short feeds under 5 minutes, persistent fussiness or crying during feeding, and poor weight gain. Other crucial signs are a weak or disorganized suckle, frequent choking or gagging, and a consistent lack of wet or soiled diapers appropriate for their age. Recognizing these patterns early is vital for your baby's healthy development. The underlying reason these signs are so important is that adequate nutrition is absolutely fundamental for a newborn's rapid growth and brain development during the first few weeks of life. When a baby struggles to feed effectively, they may not be receiving enough calories or fluids, which can lead to dehydration, poor weight gain, and, in some cases, delays in reaching developmental milestones. Factors influencing a newborn's feeding ability can range from structural issues like a tongue tie or cleft palate to neurological immaturity, prematurity, or even subtle difficulties with coordination between sucking, swallowing, and breathing. Understanding the why helps us approach the how-to with greater insight. If you notice any of these signs, the first step is to carefully observe your baby's feeding patterns and behaviors without immediate judgment. Pay attention to their latch, if breastfeeding, or how they manage the bottle. Note how many wet and soiled diapers they have in a 24-hour period, and track their weight gain between doctor visits. Keep a log of feeding duration and frequency. Then, share these observations with your pediatrician or a certified lactation consultant without delay. They can assess your baby's oral motor skills, evaluate feeding techniques, and rule out any underlying medical conditions, ensuring your baby receives the right support. Early intervention in feeding difficulties can make a significant difference, not just for immediate health, but for long-term developmental outcomes. For instance, a condition like infant reflux, often signaled by arching the back during feeds or excessive spit-up, can sometimes be confused with feeding difficulty. However, persistent reflux, if untreated, can make feeding uncomfortable and reduce intake. Another common but often overlooked detail is how well your baby coordinates their breathing and swallowing. A baby who struggles with this synchronization might pause frequently, choke, or seem exhausted after feeding, which indicates a need for professional evaluation. This early attention helps to optimize the crucial brain building that happens in these foundational months. Paying close attention to your newborn's feeding cues and overall behavior empowers you to be their best advocate. Identifying potential difficulties early means you can partner with healthcare professionals to address any challenges promptly, ensuring your baby receives the nourishment needed for optimal growth and healthy brain development. This proactive approach supports their journey toward a strong start in life and brings you greater peace of mind.